It's really, really a special night for me. And my heart is full of gratitude. I am so blessed. Being a physician has given me the chance to meet many amazing people and be part of their journeys. They have taught me and inspired me. In 1982, I traveled to the Thai border to help Cambodian refugees fleeing from genocide. I held tiny malnourished babies and wrapped my arms around the orphaned boys and girls. It was that experience that inspired me to cancel my cardiology fellowship and turn my focus on women's health and social justice. Now, after nearly 40 years in practice and 20 years running Healthcare Without Walls, I treasure the memories and successes with women I've met in our programs, women I never would have met if I had taken the traditional route. I remember an old woman who slept in a cardboard box on the sidewalk, who after years of patiently coaxing allowed us to prescribe an antipsychotic. She moved into the shelter and stabilized. I was there holding her hand when she finally succumbed to cancer, but she was in a clean bed in a nice hospital. She taught me the importance of respecting her autonomy. I remember cutting maggots out of a woman's hair, how she cringed from our help, and then visiting her with toiletries and body lotion when she was hospitalized, rebuilding her trust and self-respect in baby steps from the shame of her broken life. She taught me that you can always start over. There was the day a woman I knew showed up at the shelter covered with bruises. We put her in a cab that took her to a safe house, and later on I visited her when she got her own place. She was finally safe and happy and had reconnected with her daughter. She had never given up. Her resilience inspired me. Starting Bridges to Moms with Brigham Women's Hospital has been the high point of my career. By offering help with housing, transportation, safety, and food, we turn fear and uncertainty into hope. We work closely with the moms throughout their pregnancies and during the baby's first year. We see up close that these women are warriors. They will fight like hell to protect their children and give them a better future. One of the first homeless women I ever saw was 300 yards from Mass General's door. People just walked by without stopping, and this was 20 years after Kip Tiernan had opened Rosie's Place. Even today, 30 years later, women as old as 90 are sleeping in warm blankets on cold sidewalks. This is wrong. Physicians can choose to see their patients in a hospital or a health center or a private office, or they can look beyond the walls to the streets and shelters, as I did 20 years ago, and see a broken system that too often was leaving poor women on the outside. I noticed early on that there were no medical programs for homeless women that recognized the ever-present street trauma that they were experiencing, and they were actually skipping medical care in order to be hidden. What was clear was that we had to go to them. Just as I had traveled 10,000 miles to the Cambodian border, I made the choice to travel outside the comfort of my academic training to reach women who needed immediate health care, but who needed food, safety, and a bed for the night first. Creating Healthcare Without Walls meant looking at all aspects of how we deliver medical care and rewriting the script. It meant taking apart every intersection point to see how we can do it better, how we can ease the burdens of poverty, helplessness, isolation, loneliness, and trauma, and put the women on a path towards improved health, greater dignity, and self-respect. Although it's been over 30 years that I saw that woman wrapped in a blanket on the street, homeless and poor women still face too many barriers, too much stigma, too many punishing and confusing rules. It's more important than ever that we go to them, hear their stories, and not stereotype or diminish them. Taking a medical history is listening to each patient's story. That's what each member of our wonderful team takes the time to do, and it's where we learn the most from the women we serve. The women we know are smart, courageous, resilient, and determined. They are funny and talented. The women we know have dreams to get more education, to learn more skills, to move on from poverty and become self-sufficient. The best gift we give the women is our time. We do not make appointments, we make room. And now, 20 years later, We're asking the healthcare system to make room for us. We're asking you to make room for us. There are more women experiencing homelessness now than ever before. You have so generously helped us get this far. Help us go further. Help us help more moms and babies and the women who are alone and feeling forgotten. Help us change the systems that keep poor women beaten down. Help us help them move beyond homelessness and poverty to a better life. I have learned that one of the most important things I can do to affect someone's health is to offer hope. With your help, Healthcare Without Walls has made a difference dispensing hope with human kindness. We are changing the conversation about healthcare delivery. We're working to change health policy. We're changing lives and we're saving lives. Help us continue to sow compassion and hope to the thousands of women who need us every day. The message we want the women to know is that we hear them, we love them, and we will never forget them. We are a sisterhood. We watch out for each other, we mourn together, and we celebrate together. Most importantly, the work we do is not about them, it's not even about me. It's about the grace of God. It's about us. It's about all of us. And now, please watch this short video, and when I ask you to stand up, you have to stand up.
I think public streets are very overwhelming for anyone.
The women suffer more because of their children.